had I think a pretty interesting insight earlier this week on what some people might have missed with its impact on the Medicare Part D section, and by extension on seniors. What effect will the law have on this program? What did you find in that?
So most of the focus has been on the price controls and that part of the bill. Put that aside. The law also changed the structure of the Part D benefit. The standard benefit used to have an upfront deductible, like most insurance policies, and then had a 20% co-insurance for a while. Then there was this famous donut hole, and the donut hole a while back got filled in large part by money from the manufacturers. And then you hit a, quote, catastrophic part, but there was always 5% that the beneficiary paid as far as the eye could see. And what they did in the Inflation Reduction Act is they just said, okay, we're going to have the insurance plans on the hook for a lot more money. They're going to have 60% on what's going on in the donut hole. When we get to the catastrophic, there's going to be no out-of-pocket exposure to the beneficiary. There really is a maximum that they're going to pay. Past that, then, someone's got to pick up the tab. Used to be the government picking up 80%. They're going to flip that over to the plans in large part as well. So they're going to be on the hook for roughly $40 billion more per year than they would have under the old design. Now, collectively, plans have profits of about $4 billion, so they're not going to be able to just eat the $40 billion. They're going to have to react to to this cost that they now face. And the question is, what will happen to premiums? Like to charge more beneficiaries. What will happen to the prices they negotiate with manufacturers? It'd be great if they could negotiate $40 billion of lower prices. That'd be fantastic. What's going to happen to sort of how you design your plans, like the formularies? They're going to try to modify that so that people are using less expensive drugs, not going to the catastrophic. What are they going to do with the number of plans? There are two kinds of plans: Part D standalone plans, and then Medicare Advantage plans, which are broad insurance contracts that include the drugs. How's that going to change? And then, there's things called utilization management, but that's things like prior authorization. You go, and the doctor has to get an authorization from the insurance company before they can prescribe a particular drug. All that's meant to reduce the use of drugs and reduce their costs. Every one of those things is at some level bad news for beneficiaries.